allopathic physicians. So an allopathic physician, there's two types of physicians, osteopathic and allopathic. And osteopathic is when you use like more hands-on procedures, like try to fix stuff with your hands and stuff. Yeah. And allopathic is using like traditional methods of medicine, and like what you do is with your knowledge you try to diagnose the patient and then you treat with medicine. So we chose 3 different areas of specialization, depending on what we want to study, like specifically, because allopathic physicians are so general. So first,
pediatrics. Pediatrician specializes in child health, and they treat children from birth to age 21. They, to become a pediatrician, you have to finish as a medical doctor, and then you have to do a 3-year residency in a pediatrics program, and you have to pass a test that the American Board of Pediatrics do. And after you pass this test, you can become an official pediatrician, and you have to go through this board several times to continue with your as a pediatrician.
The specialization of OBGYN is divided into that's obstetrics and gynecology. So obstetrics is more focused on pregnant women and during the pregnancy, and gynecology is specialized more like before or after if there's a miscarriage or abnormalities in the area, and like cancers. And an interesting fact about obstetrics is that only 35% of the births are performed by obstetrics, and the rest are carried out by midwives.
And last of all, oncology is a branch of medicine that studies tumors or cancers. It can be divided into, 2 basic types, which could be either surgeon, where you do surgical procedures to remove the tumor, or you could diagnose the disease, which is allopathic physician. We're going to compare 2 universities, which are Johns Hopkins University and Harvard Medical School.
Well, Harvard Medical School is known to be one of the best medical schools in the world. It is in Cambridge, and it specializes in rehabilitation, and it has 3 major areas of specialty. That is endocrinology, that are the doctors who specialize in treating gland illnesses, neurology, that specializes in the brain and the spinal cord, and then psychiatry, that is a branch of medicine that specializes in treating mental and emotional diseases or disorders. And in Harvard you can graduate as a medical doctor, then you can do an MBA, a PhD, and an MPH. An MPH is a Master's of Public Health.
On the other hand, Johns Hopkins Medical School is located in Baltimore, Maryland. It specializes in patient care, and it gives more importance on working with peers. The areas of specialization are rheumatology, which is related to arthritis and joints. Otorhinolaryngology is related to eyes, ears, and throat, and neurology or neurosurgery are related to brains. The programs are similar to Harvard, but they don't have the Master of Public Health.
the demand in the world, that's supposed to say world. There's more countries that need to have more doctors than have excess. Like for example, in Japan, because it's a country in development, people are stopped going to colleges because there's no need for teachers, and because there's no teachers and people can't go to school to study medicine. Well, there is, but that's why there's a demand, because there's less. And in China, because there's an excess of doctors, in 2014, 50,000 people graduated from that career. So, because there's so many people, there's lower quality of doctors. And in Mexico, according to the Encuesta Nacional de Ocupación y Empleo, it says that the employability in Mexico, because there's such a demand, is 91.6%, and that in women is 40.9%, and in men 59.1%. And here's a little graphic that says the amount of disease that there is in the world. So if we can see that in America there's more, so that's why there's more demand for doctors. And
Well, the best places to work as a medical doctor are the Netherlands, Australia, Canada, United Kingdom, and the United States. In the Netherlands, specialists earn $253,000 a year in average, and general practitioners $117,000 a year. This is an average. It's not exact, but in contrast to the other countries, in the Netherlands, ignore my last comment. Well, in general, specialists earn more than general practitioners because, well, it's supposed to be better to go with a specialist because they know a specific area and know how to diagnose and treat this problem or illness.
There aren't exact companies that you could work in because doctors, they work in hospitals and not in companies, but you could work with the insurance companies, which in Mexico there are lots, but I chose GNP, and in general health clinics, which could be Centro Médico ABC. It's located in Mexico City. It's also internationally, so they exist in United States, Canada.
And the activities that you're required to do normally, being an allopathic physician, are knowing how to treat everything. And when you get a patient, you try to diagnose him after sending tests. And when you get the results, you're supposed to know enough to suggest treatments. And another big part of the job is to know prevention methods. So you can explain to patients how to prevent further sicknesses. And allopathic physicians are required to be on a very regular schedule that can go up to never leaving the place where you're working in the whole day. So to have availability. And that's it. ¿El qué? No, no sabes cómo ahorita revisar.